This is a unique conference in some ways in that it's bringing together academics and activists and people who know about women's economic and health issues outside work, those of us who pay more attention to it inside work.
Although science has much improved from the first time I gave a talk at this conference in 1996, we aren't there yet. Haven't arrived at a stage where gender is taken into account in occupational health all the time, everywhere, and certainly not the needs of women workers. There's a lot still to be done.
I think that one of the most important outcomes of this conference is that we have to consider the relationship between work and health status, taking into account that the relationship of work and health status can differ by gender. We have to also examine the profound differences in employment and working conditions of men and women, as well as the role of the family sphere for both sexes.
If we are to do studies, or if we are as unions to be passing out questionnaires, trying to figure out exposures to psychosocial hazards, we should pay attention to the gender differences in these exposures. Not just about reproduction and work-family balance, but also about the way men and women are treated in the workplace. Even within the same workplace, they can be treated quite differently.
Sería muy importante que pudiéramos alertar a todos los sindicatos y sindicalistas para que tengan una vigilancia especial sobre la salud de los trabajadores en relación a la exposición a tóxicos químicos y a campos electromagnéticos, y que se vigilen si los trabajadores están inmersos en atmósferas, las trabajadoras, que pueden alterar estas condiciones de salud debido a la situación en sus lugares de trabajo.
I talked about the problems that we run into when we use workers' compensation data as a proxy for health problems related to work and occupational cancer on the one hand and musculoskeletal disorders on the other, and showed how if you were a part-time worker it would be really difficult to get compensated, particularly for musculoskeletal disorders, so that the statistics are completely distorted because women are much more in part-time work and there's a bias against compensation for part-time workers who have, say, tendinitis.
He podido explicar que en este momento tenemos una gran cantidad de disruptores endocrinos, pero sobre todo dioxinas, bisfenoles policlorados y sustancias que actúan, sobre todo los insecticidas, que colocados indiscriminadamente en lugares de trabajo sin protección para los trabajadores han provocado unas alteraciones profundas en la salud de muchos trabajadores y trabajadoras en España.
It's really nice to be giving a talk at a place where unions and working people are taken into account, and that gives a different flavor to the conference. We're much more, I think, aware of the policy implications of what we're discussing.